Why do I have a runny nose with a spinal CSF leak? There's many reasons why you could have a runny nose. You could have a runny nose because you have a cold. You could have a runny nose because you have the flu. You could have a runny nose because you have the coronavirus. You could have a runny nose because you have allergies. You could have chronic sinusitis. You could have a fungal infection. You could have fluid retention cysts. Most people with a runny nose do not have a spinal CSF leak. If you are just recovering from being sick, the illness is most likely the cause. However, if you are going weeks, months, or years with an unexplained runny nose and the other symptoms I'm about to discuss, it's probably time to talk to a physician. So it's time to make a big distinction with spinal fluid leaks. There's two different kinds of spinal fluid leaks: cranial leaks and spinal leaks. And the thing that can make things even more frustrating for spinal and cranial leakers is that sometimes people with cranial leaks can have some of the same symptoms as leaks of the spine. This can lead to people with cranial leaks having a delay in diagnosis. People with spinal CSF leaks, the leaks in the spine, tend to have more severe positional symptoms, and this list does not include all symptoms of either kind of leak. For spontaneous cranial leaks that happen without some sort of accident or surgery or incident, some of the symptoms can include people who have a high underlying intracranial pressure. This is usually young women with a higher body weight, but it can be anybody, any gender with any body weight. Usually happens with the metallic taste in the mouth, hearing loss, headaches, and runny nose or liquid in the ear. In that case, that would be spinal fluid. For spontaneous spinal CSF leaks, the leaks in the spine, the pain usually happens in the back of the head, but it can be anywhere on the head. It tends to improve when laying down. It worsens when standing up. It can start or worsen with exertion. It can have one of the symptoms can be pain between the shoulder blades, pain or numbness in the arms, and that's usually specific to the spinal CSF leak patients. Changes in hearing, dizziness, nausea or vomiting, and changes in vision. So the big question, right? Why do spinal CSF leak patients get a runny nose if it's not spinal fluid? So the general consensus by doctors and specialists who treat the condition, it's caused by traction or irritation of the cranial nerves. So the brain and the spinal cord are surrounded by a tissue called the dura. The dura is filled with a fluid called cerebrospinal fluid. So spinal fluid is what keeps the brain floating up in your head. It reduces the weight of the brain to around 40 grams, I think. So when spinal fluid is lost via spinal CSF leak or a hole in the dura, the brain sags down toward the spinal canal, putting traction on the cranial nerves, causing that runny nose. And if you have a spinal CSF leak, it's probably giving you a really, really, really bad headache and some of those symptoms I listed earlier. So, to sum it up, if you have a severe positional headache, see a neurologist and request a brain MRI with contrast. 2. Runny noses from spinal CSF leaks, ones in the spine, not in the head, are caused by irritation or traction on cranial nerves. The liquid that's coming from your nose, if you have a spinal leak, is lymphatic fluid or mucus.